most famous physical therapist on the internet.
Hi folks, Brad Heineck, physical therapist.
I'm Chris, the pharmacist.
And I'm exactly one half of the most famous physical therapists on the internet.
In your opinion, of course.
That's right. But today we're fortunate enough to have Bob off and Chris, the pharmacist, on. We've got a very serious subject to cover. We probably won't get that'll be the humor probably not for the whole video.
I think that's the extent of it.
Exactly right. The title of the video is Fibromyalgia. Have pain, fatigue, brain fog, memory loss. Those are all typical symptoms. We're going to go through 4 steps to success to help manage and overcome these problems associated with this syndrome. Before we go any farther, we do want to get a little business out of the way, though. We do have a giveaway today, and it happens to be a mattress. Now, this mattress can be wonderful advantage for sleep. We're going to talk about that a little bit. But can you pull the sign up, Chris?
You betcha.
See, I normally pull the sign up. There we go. For the giveaway, if you want to get into winning one of these mattresses, go to bobandbrad.com. Go to the giveaway section and you'll see what you need to put in to get on it. You can also go to the Facebook, and at the top of the page, it is pinned. Check that out. Also, we are on Twitter, Instagram, as well as I think
the TikTok.
The TikTok, that's right.
There we go.
And podcasts as well are going in full force. We've got some excellent people that we've interviewed, and sometimes us ourselves, Chris and I have been on some podcasts, so check it out. Let's get on to fibromyalgia.
All right.
Let's take the mattress and we'll get that out of the way. Fibromyalgia is a very painful, debilitating condition.
Absolutely.
And if you have it, you've been diagnosed, you're very well aware of this. It's oftentimes in some specific parts of the body across. I'm not going to go through the points because I do have them mapped out, the most common locations in the body, but typically the upper back and the chest, around the hips and waist, and I may be missing some that you may be suffering from, but it's a chronic condition, goes on, and it's really life-changing.
Yes.
We have done research on it. We both have patients over the years that have this, and we came up with a 4-step guide that you can vary from, because everyone does not treat fibromyalgia in the same manner. It's not a cookie cutter thing. Chris, do you want to step in so I can quit talking so much?
Yeah, no, I mean, fibromyalgia, it's not even really a disease state. It's much more of a syndrome. I mean, so when we think about it, it's many, many different things. And oftentimes when patients have the diagnosis of fibromyalgia, it was arrived almost backhandedly, like a process of exclusion. So doctors, it takes average of 5 years just to hit the diagnosis in most cases. And you're talking about, 2 to 3% of the population, about 70 to 90% women.
Okay.
So I mean, there's some unique facts about fibromyalgia, and really, oftentimes when they come in, they present with pain, and they just don't know why.
Sure.
But the doctors there's not a set test for it either, which makes it so darn frustrating to diagnose as a clinician.
Sure.
And it makes it really, really hard on the patient because they're just waiting for an answer. I think so many times when we get an answer, it's nice to start to turn the page and work on the healing process.
Sure.
And that's so darn hard. So your doctor will rule out other arthritis form conditions. I mean, you'll see strange things that pop up like IBS, inflammatory bowel syndrome.
IBS.
Inflammatory bowel syndrome.
Oh, I'm sorry, yeah.
So basically, constipation, diarrhea type dominant side effects with a lot of pain in the tummy. And, with that respect, you're like, well, are we treating one thing? I mean, are we looking for an elephant and it should be a giraffe kind of thing? And they just don't know where it goes. Well, I still have these symptoms, but, I'm hurting here, hurting there. Every time I'm in pain for every second of the day from the moment I wake up to the point where I go to bed. And, and then your friends and family will be like, why are you always hurting all the time? And, then so ultimately when they get the diagnosis, then I think the healing can begin. And I think we have lots of things that we can kind of start to share to try and help to make sure it's not a hopeless condition. It's something that we can go into remission and we can move forward and have very happy, effective lives. So there's lots of good things that we can do to help people.
Right. And that can be the challenging part. I did want to mention, as far as from a therapy standpoint, when I look at it with people is part of the explanation of the pain is, these muscles will tighten up in these painful areas. And when a muscle tightens up, there's less circulation because the muscle's tightened up like a ball, a real knotted area, and blood cannot circulate in that near as well as a relaxed muscle. It's like a sponge. It can absorb the blood and the nutrients and everything, the oxygen that fresh blood provides. And we want to get rid of the waste products. And that's kind of you may not have heard that term thinking of it in your muscles, but the waste products being carbon dioxide, lactic acid, and these things when they build up create that pain. In that. So getting to be able to relax, it can be a big part of this. But we're going to talk about that a little bit more. So again, the point I wanted to bring up, Chris, is this is kind of like back pain, although it's different, but in the way that you look normal. I mean, it's not like you have a broken arm. You look healthy, but you've got this pain that the average person who's not familiar with it, who's ignorant of fibromyalgia, they don't understand.
No, I mean, and that's one of the biggest tragedies of fibromyalgia is we all look perfectly normal if we're suffering from it,
right,
except for the fact that we're not because we're feeling so miserable. I mean, what we think is that it was probably brought on by it could have been a stress event, a traumatic event. So whether it's a car accident, stress, an infection. So we don't really know the nexus event that caused it. And we know that it runs in families. So we don't really know, but what we think we understand right now is it seems to be nerve transmission is problem. So if you think of your nervous system as a series of highways, something's not right with that. And when we talk about the pain points, and there's at least 18 of them, I think that they look at pretty routinely.
Yeah.
But I think there may be others, as you alluded to. But what happens is that let's say we're listening to the radio and we like it loud, we're rocking out, we're driving, it's on 10. Well, your pain, if you have fibromyalgia, is easily an 11 or higher. So it goes beyond that. And just simple things like if you went in for a massage or you just hit your arm on a door and that one of those tender spots, it puts you through the roof.
Sure.
And so it's not a normal response. Like for anybody else, it gets, it's just a little slap and you're like, why did you almost want to drop to your knees or actually have tears in your eyes? And it's a very real pain. I mean, it doesn't, just because it doesn't look bad, it's bad.
Right.
And so, we go through a lot of different things to treat these, and we'll jump into those as we go forward.
So what I did, I went to, I wanted to find, because, I'm not a fibro specialist. So I went to Adrian Lowe. He's a physical therapist. He's got his PhD in pain. He treats people with fibromyalgia on a regular basis, and he does research, and he has dedicated his life to pain, people with chronic pain. We've had him on our show. Actually, lives in Iowa, not too far from here.
Yeah, right down the way.
Yeah, and he's just a heck of a nice guy. You can just tell his life is, this is his passion. So he does have a book specifically for fibromyalgia. He has them for other chronic ailments as well, painful ailments. The name of his book is Your Fibromyalgia Workbook. It's made for the lay person, so you can go through. But one of the things I wanted to bring it down into, and I heard this from him, and I got this from him, break it down into the most simplest areas to address for pain. And so there was sleep.
Yep.
Okay, you've got to
critical.
Yeah, as opposed to going after this painful condition as a whole, break it down into four. One is sleep. Next one is understand your pain. Try to get a better understanding of why it, because people come out with, after they see the doctor or maybe someone else, they say, well, they think it's just all in my head, which is the farthest from the truth. And you're not going to progress if you don't understand it a little bit better. And he does a really good job. I've watched some, talking to him and on his videos, or his way to communicate that the patient is really good, as opposed to coming across in a real technical manner. He comes across in a personal manner so you can relate to it. And then exercise or motion. I'm going to show you a way to work into movement, because most people with fibromyalgia don't want to move because
No,
it hurts.
The pain is so extreme.
Right, exactly.
Yes.
So it's like, I know I should be moving, but it hurts worse. And so there's some ways to work through that. And then we are going to touch also on some diet at
Yep.
the end. We're not dietitians, but
No.
we can give some good general
Oh, absolutely.
rules for that.
Absolutely.
Did I miss one?
No, I think we'll start with sleep. And I
Yeah,
think we'll move.
and that's what Dr. Lowe said. If you can get your sleep under control, that's half the battle right there.
Absolutely.
And it's not easy because we have people having problems with sleep without pain because
Sure.
of other issues.
Oh, absolutely.
Do you want to talk about some sleep?
Well, we can. I mean, sleep is, one of the hallmarks of fibromyalgia is the fatigue, and they're just all not only in pain all the time, but they're always exhausted. I mean, they're talking like just bone weary tiredness.
Sure.
So you're just dragging tail every moment of every day, and so how do you fix that when you're sore, painful, tired? I mean, it's just a very frustrating point. So one of the things that we can do to try and gravitate towards better sleep is, well, I always call it sleep hygiene, but there's other ways of looking at it. But I think that it's, there's some basics with sleep that whether you have fibromyalgia or anything else are just keys to getting a better night's rest. Because if we everything falls through from sleep in a lot of cases. So if we can get the rest, our bodies begin to heal, things calm down, you get some better, that your nervous system seems to settle out. So we'll kind of see that as we talk, but really the reality of it is to go to bed, you want to have a nice quiet setting. You want a dark room. You want to be putting away your iPhones, your iPads, your laptops. Probably don't even realize to be watching TV because there's your phones and your iPads and computers reflect that blue light.
Right.
And that's stimulating to the brain, and that keeps us awake to begin with, which ironically is kind of strange because a lot of people, I'm just relaxing, playing a little, keyboard Sudoku or Words with Friends or whatever.
Even on your cell phone, there's enough blue light to affect. Okay.
And some of them now have recognized that. I know that with Apple, they do have a dimming setting. So it's certainly something that I would encourage to take advantage of even as you're approaching bedtime. But we'd still encourage you for putting all the things away so that you're heading into bed in a quiet, relaxed manner.
Right.
So we want to have same set time. So you want to have a same bedtime, and you want to try and establish the same wake up time too.
Some consistency.
So that you're getting a nice round the clock chronologically. You just want to have that same set time. I mean, ideally 7 or 8 hours.
Sure.
Some people need a little bit more. So you know your body and you know what you need. But so you want that quiet time. I think white noise is actually important for a lot of people because, and what is white noise? Well, it's not a color, but it's just kind of a weird kind of a kind of noise. So like a fan.
That's what we use.
A fan
just
works
use a fan.
phenomenal. And it's actually, there's lots of studies outside of this, what we're talking about, that actually shows that white noise just relaxes the brain. And when you look at the brain waves and the delta waves and all the things that they're looking at with sleep specifically, you just get a deeper level of sleep.
Sure.
And so it does help to promote that healthier sleep. And you want a kind of a cool room. You don't want a real hot room.
That's
so
a big
your
one.
body, as the temperature slows down, heart rate slows down, you promote deeper sleep. So we head into REM, which is actually one of the restorative parts for our brain, but also our body, we're learning. So there's a lot of fascinating things with sleep that oftentimes we take for granted, really, because you go to bed.
I just want to say, I just read a book over a few months ago by Sean Stevenson, and it's about sleep. If you look up the author, Sean Stevenson, what is it? I can't remember. The title is very obvious. It's about sleep. He had the whole book talks about things. One of the things he was so specific on having a dark room is if you need light to be able to see your time, get it in red. If you need a nightlight, get a red nightlight so you don't trip over. There's something about red that does not produce the same as the melatonin in the brain.
Blue is stimulating, and red actually, it's interesting because it doesn't throw off a lot of effects. So if your partner's there too, it doesn't annoy them. It just doesn't reflect. So that's why the military uses it to read their maps and things too. But lots of studies on those wavelengths.
I want to get to the next number, understanding of the pain. But before we do that, medication for sleep, that's your specialty?
Yeah, well, I dispense it. It's not my specialty, but I can tell you a lot about them. But the reality of it is sleep does not come easily to millions and millions of Americans. And when you're talking about, like 3 to 5 million Americans with fibromyalgia, sleep is one of the things that's a challenge to achieve. So there's a lot of different ways that we can approach falling asleep. We've talked about some of the basic mechanistic things that we can do, but sometimes we need pharmaceutical help. Not always. I mean, sometimes it can be something as simple as melatonin. For some people, you can get it through foods like raspberries and pineapple or cherries. So some people like that because it also gives you other healthful nutrients. And it also helps to stimulate that sleep about 30 minutes before you want to lay down. Otherwise, we have to use medications. So something like trazodone, which is an old school antidepressant, which isn't much of an antidepressant, but interesting with fibromyalgia, it has unique capabilities because it works on some of those neurotransmitters, which when we talk about fibromyalgia as being kind of that highway disorder where the nerves are firing improperly, it raises serotonin and some dopamine and norepi levels to try and help to improve transmission. But the benefit for people that can't sleep is it just makes you doggone tired. And so it helps you to sleep and get more fitful sleep. But there's other drugs that we can use. I mean, the Z drugs, which we did a video about a while back. So you talk about like Zolpidem is probably one of the more common ones, but azopiclone. And
so the big picture, drugs is pharmaceuticals for sleep is not going to be a long-term.
No, we hope that you can naturally do it on your own because there's really no substitute for it. I mean, when it comes down to pharmaceuticals, we're a society. America is in a society of better living through chemistry. But if we can do it without, it's best. And I'm telling you that as a pharmacist. But I mean, if you can, you can. But if you can't, you can't. And those of you that know that you just can't sleep, you understand it and you realize the need for these medications. Obviously, your doctors do, and they do a very good job of trying to diagnose, and they'll try and mitigate where they can. It depends on the circumstance. Everybody's case of fibromyalgia specifically is different. So if you had it and I had it, we'd have two totally different stories.
Yeah, I should have said this. If sleep quality is not one of your biggest problems, you could probably skip this section, but it's probably part of it.
Everything stems from that fitful night of rest. And that's one of the things that, and it's hard to achieve that. That's why you want to go into a pattern. And that's why it's so important to going forward that if we have this diagnosis of fibromyalgia, that we learn to make some of these lifestyle changes so that we can go forward. So for sure.
Okay, so let's go on to the next topic, understanding why you hurt. I know from my point of view, my understanding as far as the physical part, I talked about tight muscles. We need to get them relaxed so we get the blood flow. I'm going to show you an exercise warm-up that actually you could do before you go to bed. It may help you relax so you can sleep better. But I think the best, as far as I'm concerned, my advice is to go to an author like Adrian Lowe, read some of his information, YouTube, his name, see and listen to how they talk about these experts that have studied it and dedicated their life to it. I know one of the analogies he talks about is, and it's a lot better coming from him, but he talks about that pain. It's there and it's so painful, and he relates that to a lion coming into the room. Like if you get tapped and you have that pain, he says, there's that big lion and there's that fear response. And if you can work it out so that that big lion coming in the room, getting that fight or flight response, if you can get that big lion down into a little cub, so that fight or flight response settles down as well. And that's one of those things that is easier said than done. Again, that's why from an expert, it's going to make more sense for me.
Well, and I think that's why his workbook is so important. I think for a lot of people, I think it gives nice, easy to read steps that are going to allow them to relate to their day-to-day activities. And so, one of the things that they talk about also is cognitive behavioral therapy. And it's kind of an understanding of the condition. And I think the more we know, the more we can cope with things more effectively. And whether it's more of a CBT kind of cognitive behavioral therapy thing, where we reach out and we get that understanding for why we're hurting, when we understand the why, and whether it's writing down some things within what Adrian has done with the workbook. I mean, it definitely helps us when we have that understanding. It allows us to accept it and make it become part of us. And so we can face it more easily without the fear and the frustration that is associated with it.
I think I do want to also mention, you said there was a patient of yours had chronic low back
This
pain.
is a chronic pain, but yes.
Yeah, but he used Adrian, one of his books.
One of his workbooks specifically,
Yeah.
and he completely is opioid free now. Got to be close to 8 years now.
Oh,
So, and then he was a strong opioid user, and he just knew that he was to a point in his life where I can't keep doing it, and he's actually having other subsequent side effects as a result of that.
sure.
Which, just to briefly touch on, with fibromyalgia, there's a lot of drug therapies that we do. One of the when I over my career, I've been doing this for 26 years. Fibromyalgia just kind of came out in the mid 90s when I started coming out
Sure.
of school. And, one of the things, doctors weren't quite, they just figured, well, we got this thing, we put this label on it, and it's fibromyalgia, and it's pain, it's chronic pain. So what do? Well, we treat them with opioids.
Yeah.
Well, we've found out that that is the last thing on earth you want to do, simply because they're addictive. And the reality of it is what do pain medications do? They just make you not care about the pain. The pain is still there. So when we're treating FM patients, a lot of it's going to come down to sleeping well. We're going to talk about exercise and things
Yep.
like that shortly, but the medications that we rely on are going to be antidepressants and maybe muscle relaxants. So those are the things that help to bridge and improve neuronal transmission, that highway.
Sure.
So things like pregabalin, things like Savella, which is milnacipran, or things, any of the antidepressants, but duloxetine or
Right.
Cymbalta specifically are indicated directly for FM.
Sure. And so what I want to go, should we jump right into
I think so.
segue into the
Yeah,
exercise?
let's go into the exercise.
So exercise, and Chris, we've talked about this, as a pharmacist, you're saying exercise seems to be the way to go versus
drugs.
Right?
Absolutely.
And again, we talked about the pain gets worse with exercise. So why do I want to exercise? So I want to show you, this is from a fibromyalgia patient. She's actually a doctor, and I kind of modified a little bit from my therapist background. Before you exercise, and I'm talking about exercise as simple as a mild walk, because that can really be uncomfortable.
Yeah.
Do the warm-up. The warm-up, I'm going to recommend,
Oh, wait, hold that.
I think it's down here. And this is one thing I do with my back in the morning. I got spondylolisthesis. If I try to warm up in a standing weight bearing position, it is uncomfortable. It's not fun at all. So I lie down on my back, and it just changes. Your muscles are much more relaxed. Same with
gravity.
Yeah, exactly. So you don't have to fight gravity. So you're going to lie down. You can do this on your bed. It might be better on a carpeted floor. It depends on how you feel about getting down onto the floor or not. But you're going to start out with a deep breath. Everything should be quiet. You're not going to have your dog licking your face or kids running around.
It's going to make a problem.
Yeah. And take a deep breath, 2 or 3 deep breaths in your nose and out your mouth. And they talk about meditation, if you can meditate, anything to allow the nervous system to settle down and relax. We're going to start with the feet and probably shoes off. I'm not going to take mine off for the video. You can do it with the shoes on. And you're going to do, 5 to 10 ankle pumps. You can do more if you'd like. Allow them feet to relax. We'll get that circulation going. Everything is relaxed. You're going to take your time, and we're going to go to single knee to chest. And everything is just in slow motion. I'm going to go down to 2 or 3 motions for the video. You do as many repetitions as you'd like to, and let it go down slow. Go to the other knee. And you may find one leg or one arm, when we get to the arms, is more painful than the other. Just take your time with it. Read your body. Get used to it. Then we're going to go both knees up and bring them up. Help it out. Stretch here. Get that low back and those hips in the back. You'll feel those muscles stretch. Take your time with it. If it's too uncomfortable, skip that stretch and go to the next one as we go on here. And then in this position, relaxing again, and I call them windshield wipers. Every time I have a patient I say windshield wipers because I say hip rotations. It doesn't make as much sense. And it's like windshield wipers go back and forth. If it's painful one direction, don't go that way. Go the other direction a few times and then bump into the other painful direction. And it may get better as a result of going the other direction. Do it as appropriate as your body allows. Okay. The next thing we're going to do is we're going to go up to the arms. And here we're just going to do shoulder flexion, as tolerated. If you want to bring both hands together, if that helps, that may be a thing to do. If one arm is weaker or has more pain, let the other one help so it relaxes it more. Whatever works out best for you. Okay. These are the nice kind of a push-ups you can do with fibromyalgia. Just I call them air push-ups. I used to do these when I was in karate, just as part of a warm-up, and it was kind of a fun way to do push-ups.
Get those shoulders going.
Yeah. Okay. And then out like snow angels, just bring your arms out to the side and bring them up as far as you feel comfortable. Okay. And then we're going to go into the shoulders and squeeze the shoulder blades back and down, and then you can make your circles. You know, if you don't feel comfortable doing it this way, you'll find out we're going to get up. And oftentimes people find it better in a seated or standing position where you get those shoulders. Again, because a lot of the pain is going to be up in those shoulders and you need to relax. And throughout this whole thing, we're always thinking about relaxed, deep breathing. And then, you know, this might be a good warm up for either bed or for going out and doing your walk or whatever your exercise program is. What kind of exercise programs are there that you have found in your research?
Well, you know, it's actually, I think it comes down to what you can commit to and what you enjoy, what makes you happy.
Yep.
And so, I mean, some of the things that, you know, when we have fibromyalgia, we're in that much pain, you know, we want to do something simple. So it might just be a walk to the mailbox for your first go round.
Sure.
And then we just progressively add to it. And it's not to say that you can't go out and enjoy weightlifting, aerobics, kayaking, biking, swimming, hiking. I mean, there's just so many things that you can do, but we have to realize that we have to kind of that know thyself.
Yeah.
You got to know when you're overdoing it. So, and you might find as you early on, particularly, you might not know what you can get away with and what you can't, and it might set you back a few days. You know, what might be something where, yeah, we have a little bit of mild soreness or stiffness from exercise, like we all kind of experienced. The FM patient, it can be much more severe. We're like, I can't get out of bed. That just smoked me.
Yeah.
And so we wanted to ease into it. So short walks, gradually building up, maybe gradually building in intensity. But when we start those workouts, like your warm up that you just showed, I think could be done with just about anything.
Sure.
I think that would probably apply to that.
Yeah.
And then when we start, you don't want to start out sprinting right away.
Right.
You know, you start walking, maybe add a slight little jog if that's something that motivates you. But just, you know, maybe it's mailbox to mailbox.
Right. And that impact, I have a feeling most people don't like to jog.
No, and it doesn't have to be. I mean, it can be yoga, it can be Tai Chi, and they've done very extensive studies in things like yoga and Tai Chi because of this, and Pilates specifically.
You with fibro patients?
With fibro patients specifically, they actually have, and they actually show by like yoga in particular, you have these poses that we hold and such. They also work on the flexibility, which does a phenomenal job for those muscles, which again, I'm preaching more in your church than I am mine, but
that's all right.
But at the same time, they've shown to be very, very effective. I think a lot of times too, you always hear the phrase "misery loves company." I think that, you know, look out for groups. A lot of places now, we belong to the YMCA locally where we go, and actually within those organizations, they have groups for fibromyalgia patients.
Sure.
I would encourage you, whether it's, let's say you're going to Mike's gym or whatever, see if they've got a fibro board where they have other people with like problems, where you can talk to people and see what worked for them. How did they start? What helps them? Maybe you can share your experiences. And a lot of times when we talk about things, all of a sudden it's like, okay, well, you know, this worked really well for Mike, and, you know, I'm going to try it.
Right.
You know, and I think there's some
put
positivity.
Some light at the end of the tunnel for
put some positivity in there. And I think the one thing we have to know is, you know, if you accidentally overdid it, just realize that this is baby steps, and we have to work towards a goal. And that goal is getting back out there and not letting the disease control or the syndrome controlling our life.
Right.
We're going to take control. And one of the biggest things that we can do, number one, in my opinion, after sleep, I guess we call it number two, would be getting that proper exercise, because we need to help make those nerves and muscles work together. And when you're stronger, by even just simple things as walking or just yoga, Pilates, Tai Chi, swimming, biking, whatever you choose, I think goes a long way to helping improve those symptoms. And also, not only that, when we fatigue the body, we sleep better at night. So it all kind of falls back to sleep anyways.
And we did segue actually into the number 4 on the 4 steps was motivation, a reason for you to get up in the morning. You know, hopefully you can, if it's your job. I know there was one woman, she was a farmer, and she had to get her work done. And that
Yeah.
worked out good for her because she kept moving throughout the day to keep the farm going. And she said she was very, that really helped manage her pain. Although she was still working on, at the end of the day, it would come back to get her. So that was part of her next step, was to get that aspect of it. So it's a 24-hour relief.
Sure.
But still, it was a whole point. And I like what you're talking about is, to be around positive people, support groups, what you read. Find some books like by Adrian Lowe and other people who are experts, or people who have written
Absolutely.
their success stories if they've had it. If someone else did it,
Oh, yeah.
maybe I can too.
Absolutely.
Gives you that light at the end of the tunnel. So critical. Should we go into now this is number 5. We put this in because we wanted to just touch on it, and that's diet.
Diet.
We're not dietitians or nutrition experts, but
Yes, nutrition is a critical component of any health aspects anyways, but actually eating well, one of the things with fibromyalgia, maintaining a healthy body weight, and things like we can get vitamin D through food. Obviously it's going to be your sunshine vitamin
Sure.
too. Magnesium is an interesting element, but it seems to
Yeah.
help with muscle functioning, and so it's going to be your leafy green foods,
it's like spinach.
and kale and lettuce, romaine lettuce, because it's darker.
They need
It's better
that
than
darker the
iceberg.
greens. Yep.
Yeah, your darker greens, broccoli. I mean, there's nuts, almonds.
Yep.
There's lots of things that can be garnered. Legumes of any type, unless you have like certain allergies to things.
Sure.
But we want to be mindful of that. But I think lean protein. So you want to find things that will help, because that helps with muscle restoration.
Sure.
and building. Bone health. A lot of times, and I didn't touch on it heavily, but most people with fibromyalgia have multiple other syndromes or issues or disease states, whether it's
Right.
osteoarthritis, osteopenia, rheumatoid arthritis, IBS we had talked about. So nutrition comes into play with all of those. And so if we're helping, whether we're going like a gluten-free diet, for some people seems to be a very effective choice.
Yep.
So taking the wheat out of the equation, basically.
Right.
So if we can do that, that seems to be very beneficial. The lean proteins, whether fishes, lean beef, grass-fed beef, that type of thing.
And I
Chicken.
think this next part, we're talking about what we should eat, what we shouldn't eat. Everyone is hearing this now. Stay away from those highly processed
Oh, yeah.
sugars.
Nothing in a box.
Yeah,
I mean, it's
yeah.
just bad. They have lots of other chemicals in there that just aren't going to really support what your body
Yeah.
needs. And so when we give the body the right fuel, I think a lot of other good things happen from
Yeah,
that,
yeah.
and gives us the energy to sustain and be able to do the exercise programs. So all these things are very holistic and kind of work together, kind
Yep.
of like a big circle.
Right.
You take something out, and all of a sudden you got a leak in your circle, so to speak. If it was holding water,
Right.
you'd have a leak. So they're all very, very important aspects of treating fibromyalgia. And so I think it's just critical and it's baby steps, guys. I mean, this is not easy for anyone. And for the people that are naive to fibromyalgia patients, I mean, just do what you can to support them, because
Right.
they need your help. They need your understanding. And, sometimes it's hard to relate. When you don't walk in somebody else's shoes, it's really difficult to see from another point of view. But
Mhm.
when they tell you, I hurt, don't just go, you're being a Sally.
Yeah.
No offense to people named Sally, but at the same time,
Yeah.
we need to be respectful of that and support them and say, well, how can I help?
Sure.
And so just
Exactly.
maybe you can pick up the grocery bag for them, or maybe you can grab the milk from the grocery store.
Sure.
Just little things.
Yep.
It helps out quite a bit. And I
Yep.
think there's a lot of good things that we can learn.
All right. So one step at a time. Don't try and tackle everything at once. Look for everything you can. You're going to find ways, and all of a sudden something will say, oh, that's helping. And then you get that point, and we're going to go to the next step. And we really wish your success and progress one step at a time
Absolutely.
to get through this. So very good from Brad and Chris, and Bob is also along with you on this journey as well. Thank you.
Thanks, guys.